Healthy mothers, parents, and babies are a cornerstone of thriving communities. Maternal health refers to the health of women and other birthing people during pregnancy, childbirth, and the following postpartum period, sometimes called the fourth trimester. With the right care and support, each of these stages can be a positive experience. Unfortunately, every year in the United States, more than 65,000 women suffer complications related to pregnancy that are life-threatening, and more than 700 die every year. Maternal mortality is defined as the death of a woman during pregnancy, at delivery, or soon after delivery. Maternal morbidity is a term used for injuries or negative outcomes a woman experiences related to pregnancy that do not kill her. The health impacts may be life-threatening and may impact her for the rest of her life. Both are currently on the rise in the United States. The good news is that we can reverse this trend. Access to quality healthcare services and other social determinants of health play an important role in ensuring birthing people have positive outcomes such as safe and healthy pregnancies and births. In 2019, the Centers for Disease Control and Prevention, or CDC, published a report stating that about 60% of the pregnancy-related deaths that occur annually in the United States are preventable. We know that roughly 1/3 of these deaths are due to heart disease and stroke. We know that stark racial and ethnic inequities exist, especially for Black women and American Indian and Alaska Native women. We know that listening to and involving pregnant people, families, communities, as well as the community health workers, doulas, midwives, nurses, doctors, and public health workers who care for them is key to improving maternal health. We also know that addressing the health of individuals before and beyond pregnancy is essential. Collaboration and strategic partnerships are instrumental in ensuring that mothers, parents, and babies have positive experiences and outcomes. The Maternal Health Learning and Innovation Center is committed to supporting maternal health practitioners in public and clinical settings by sharing best practices and promising innovations. Our goal is to ensure that every pregnancy, birth, and postpartum experience is a healthy and positive one through policy, innovation, and engagement.
Again, I wanted to say good evening, everybody. My name is Jocelyn Rodriguez, and I am the founder of Coaching Salud Holística. So I definitely wanted to just start off with this video with the Maternal Health Learning and Innovation Center. They are a great source of information for those who are interested in learning more about maternal health. I will also be providing more information regarding the different type of work that can be done in maternal health or overall birth work. For you to have that information, there's different roles that can play a significant impact, or could have a significant impact in a family's life. So as stated, this is a recorded session, so you will have access to this after today's session. And if you have any questions, please feel free to put that in the chat. So a little bit about Coaching Salud Holística is a for-profit consulting company for health education programs in the state of Maryland. We provide a wide range of services regarding capacity building and other services like health education for many schools, nonprofits, and companies in Maryland. But we also do provide pregnancy coaching on a one-on-one scale. We do also provide we do provide discount for families who are of the lower income set, but that is some information that I'll be sharing at the end. But our mission is overall just to seek to provide health equity through health education to all underserved communities. And we do that in English and in Spanish, virtually and in person. So today's agenda, we're going to be talking about a lot of things related to maternal health. That is why we're here, right? To learn more, how can we play a role in the overall improvement in health equity and health and well-being for our mom and babies and families. And so starting with, we will have a guest speaker, but from there we will be talking about the health disparities that is seen in the trends that is occurring in the United States, especially starting from COVID and seeing that impact in maternal health. Also just going into understanding prenatal and postpartum care, because that plays a significant role, having that background information to be able to promote that within the community that we are in, either for ourselves or that we work for. Then we'll talk about how can you access prenatal care. We will just give some information, where are some points of contact that you can reach out to if you do not have, or you or your clients or whoever it is that you are interested in getting this information for, can access and talk to have that access to prenatal care, as well as just talking about birth planning and what are those components to be able to ensure an overall positive experience for the family, as well as a positive experience in postpartum care. So I did want to start off, I don't know if I saw the speaker who will be representing the Laurie Center.
You did. Hi,
Okay.
Jocelyn.
Hi, okay. Let me give you the ability to share.
Okay. I don't have anything to share, but I will speak, and I will show everyone our website. But my name is Liz Vertage. I'm with the Laurie Center Head Start program. We are a Head Start program, Head Start and Early Head Start. So we serve children ages 0 to 5, along with pregnant women. We serve the areas of central and northern PG County, as well as Montgomery County. If you are familiar with Head Start, which it looks like some of you probably are, by the names of those email addresses, you know what we do. We also have a home visiting program. So we have center-based option, childcare options for the 0 to 5-year-old group. And we also offer a home-based option for children and pregnant women 0 to 3 for those children. With Head Start, as you know, benefits of Head Start, it supports your child's growth, development, and learning, increase family literacy across the board, promote healthy parent and child relationships, provide parenting support and education. And we also serve the needs of children with developmental delays or diagnosed disabilities. Criteria to be eligible for our program: families must meet the federal poverty guidelines. So at or below those guidelines, children have to be 5 years old or younger. And also live in those areas as mentioned before. We serve Montgomery County as far as Rockville. I don't think I stated that before. You might hear of the Laurie Center School. So there is a school that is for our older children, and that school is actually in Rockville. It's the Laurie Center for Children's Social and Emotional Wellness, and we fall under them. Our parent organization, our umbrella organization, is actually Adventist Healthcare. We are always looking to add families and children to the program. We love having families apply. We do have a waiting list. Doesn't mean a family will be on there long. There are certain criteria that families must meet, and then depending on needs and availability of centers, you can start almost immediately. And so to apply, we always direct families to apply at our website. So I'm going to see if I could share. I never use Zoom, so I think I'm going to do this right. All right. So minimize this. So you'll see this is lauriecenter.org. So you go to the main page, lauriecenter.org. This is what you're going to see. And under the Laurie Center, there's Early Head Start, and then there's the Parent-Child Services School. There's also a therapeutic nursery program. This is a program specifically for children who, for example, have not just done very well in public school, due to staffing just really not understanding how to manage the classroom. So it could be children with developmental delays or disabilities or high needs or any types of diagnoses that require more attention. So therapeutic nursery classes are typically smaller and do have a lot of providers. And there is the therapeutic nursery at the Rockville location in the school, but also at our Highland Park location in Hyattsville. And so to apply, you click on the Early Head Start link. And if you scroll down right there where it says apply, you apply right there. And if you have any questions about applying or where you are in the enrollment process, you can call the phone number listed here, 301-941-7895. And that will direct you to the correct group of people, our enrollment team, who can provide you with more information on that. And Jocelyn, I believe you have a handout that I'm pretty sure you said you were going to put on your website online. So, and I see that it's in the chat. So please feel free to review that, share it with whomever you know. We are more than happy to take your flyers too and share it with our families. We have wonderful individuals that work for us who are really involved in the community and know a lot about the community. PG and Montgomery County. So we are more than happy to connect you and work as a team and work together. So thank you, Jocelyn. I appreciate it.
Of course, thank you. Yes, and you'll see those flyers in the chat, and I'll also be sending them in the email, following up with additional resources. And I think we do have one question in the chat asking if do babies and children need to be U.S. born to be part of this program?
No, no one actually has to be a United States citizen. So undocumented immigrants or even United States citizens, it doesn't matter. That is not something that we actually look for. So that is perfectly fine. We won't ask you questions. We won't delve into deep, detail about that. If you do need support in anything on that end of things, we do have our home visitors and our family support workers who are great with resources in the community that can find you support. But as long as you have a form of identification for them and meet all the other criteria, then you qualify for the program. Other automatic qualifications I should add is if you are part of the SNAP program, so food stamps. So if you do receive food stamps, you technically automatically qualify for us. So that is something else to note as well. I hope that answered your question, Karen.
Thank you so much. Did anybody have any other questions before that gets wrapped up? No other questions? Well, thank you so much. Okay, go ahead.
Someone asked if it's in the Anne Arundel County area.
No, so I'm sorry, we are PG County, so Northern and Central PG County and Montgomery County. Sorry, my dog has a toy. Anne Arundel County, I could try to find that out for you. They might participate through the Y, like the YMCA. I'm not 100% sure. I know in Baltimore they do, but I can maybe get that information for you.
Yeah, to chime in, I believe that they do it with the Y as like Baltimore. I know that they are very tied with them, so they do a lot of like similar activities and services. So I can also work on see if there's a flyer for that, but I'll definitely send that information as well.
Well, thank you for your time. Jocelyn, unfortunately, I have another obligation, but if anyone has questions, feel free to shoot them to my email and I will be more than happy to answer them.
Thank you so much.
Thank you. Have a great night, everyone.
You too. So now that we've heard, starting to hear a little bit of the resources to be able to support the maternal health families, we're going to talk about the terminology before we really dive into it, right? Because first we have to understand what is it that we're talking about? What are we going to be looking at? So maternal health and well-being is a woman's health and well-being before, during, and after a pregnancy, and includes things like her physical, mental, emotional, or social health. Infant health and well-being is similar, but more tracked with developmental milestones, education, learning, and their interactions and social behavior, as well as their overall safety and care. Mortality rate is the number of deaths in a population during a given time or place. So in other words, the portion of deaths to a population. Morbidity rate is the rate at which a disease or illness occurs in a population and can be used to determine the health of a population and its healthcare needs. Illness can range from acute to chronic and long-lasting conditions. So starting to look, right, what is happening with maternal and infant health at a global level? Well, in the everyday, every day in 2017, approximately 810 women died from preventable causes related to pregnancy and childbirth. 94% of all maternal deaths occur in low and lower middle income countries. And that is just due to the social determinants of health in those countries. And young adolescents from ages 10 to 14 face a higher risk of complications and death as a result of pregnancy than other women. Skilled care before, during, and after childbirth can save the lives of women and newborns and overall families. So we kind of heard a little bit what happens with the global health. What are some trends that we're seeing? Since the pandemic, we've known that maternal and infant health at a global level has unfortunately seen more casualties and more cases of families being sick. So in the United States, what we saw is that in the pregnancy-related deaths have happened in the past, this even before COVID, more frequently reported amongst the Black and Native American communities. Maternal health amongst the Latino community has significantly rise since the COVID pandemic compared to its white counterparts. So as you see here, this is just some information from the CDC looking at the number of deaths related to COVID. Of course, we know that COVID didn't make a big entrance until 2020. So during that time from 2020 to and 2021, we saw a significant amount of mothers and babies having illness and deaths due to COVID-related symptoms. As we all, for those who are who have not had the opportunity to work with a lot of the Latino communities, at least during that time period, a lot of the data shows that the Latino community overall was one of the most impacted minority groups due to its limited access to healthcare resources and health education. More than half of the recorded maternal deaths occurred the day of birth. So sometimes it's a lot of the fear that it might be death during pregnancy, which does happen, but a lot of the deaths do occur in that postpartum, so from birth and after. So a lot of the trends that has been seen is up until a year after a woman's delivery, she is still at risk for a postpartum, like postpartum diseases and complications that can arise. Many of the complications and reasons for death, pregnancy-related deaths are different amongst different minority groups. So this is an overall image about from the 2007 to 2016 data that was collected about women and mothers who were dying. What were the reasons? So overall, you will see that the the three significant causes will be cardiac conditions, infection, as well as non-cardiac conditions, which could be, complications during delivery that do happen. What you will see here, it does vary amongst each minority group. So you would definitely see, as stated, right, we said that the Black community is often affected. So one of the leading causes of maternal death in this community is cardiac conditions. Cardiac conditions can be things like preeclampsia, which is high blood pressure during the pregnancy, or it could even have been cardiac conditions that were pre-existing before her pregnancy. After that, we do see, looking at the Latino community or the Hispanic community, one of the leading causes is infection. So each community is to be addressed differently in terms of maternal health. Maternal health overall has many guidelines of how we can promote health amongst the communities, but being aware of this type of data allows us to be able to pinpoint at what period in a woman's pregnancy and birth journey requires more emphasis of care. So some basic needs of a pregnant person is definitely, I will definitely go back to answering the question in the chat. Yes, so there's a question in the chat that says, do you know if the infections are acquired from delivery? So a lot of the infections are, so what has been seen is, with at least the Latino community, some trends has been that many of them do not seek postpartum care due to the financial costs that are associated with it. So that is one of the reasons that we have seen infection being an issue overall, but just specifically with the Latino community due to its limited access to healthcare resources. But also seeing that infection can occur on from cesarean, if there was complications there. Again, if was no follow-up, also the quality of care can be a reason why somebody does get infection. We know that infection, also known as sepsis, is one of the leading causes of deaths in the United States and in the world. So it's infection definitely does happen within that period from pregnancy and postpartum, making postpartum care very important. And just constantly getting that education for our moms is very important for being able to prevent a lot of these diseases. So hopefully I was able to answer your question. So basic needs that, we know a pregnant person needs, or anybody really does need, is access to food. And then from access to food is not only, that, but access to affordable housing. Where is she going to live now that she is pregnant? Does she have enough space in her home to welcome another baby? Access to prenatal and postpartum care. That has been a big conversation in Maryland over our limited access to prenatal and postpartum care for many of our low-income, underinsured, and undocumented populations. And access to dental care. We know that dental care and dental hygiene has been associated with many cardiac conditions. That's pre-pregnancy and even more so during pregnancy. So a lot of things like gingivitis and many inflammation that might happen in your dental care is linked to cardiac conditions. And having more of that inflammation can be an issue when a woman is pregnant. So that having that access is very important. Access to transportation, because we can definitely say, oh, well, she has access to all of these things, but if she does not have the transportation, then that makes it very difficult. She might have to pay for that, and that is something that she might not be able to do. So she'd rather not go to her prenatal care appointment, or she might not be able to go get the free groceries that are being distributed at a food site. So just being aware of the different needs that are basic, that are truly basic to a pregnant person, can definitely start to help us take a step back from not only the literal healthcare version of this, but the social determinants of health, which we'll talk about shortly. Also, just being aware that, there is a need for material assistance. Maternity clothes, does she have clothes that are going to fit throughout her pregnancy and delivery? Does she have access to a car seat or other infant essentials? What about access to health education or childbirth education that is at a level of understanding that for them? So meaning, like, is it accessible for them, whether it is due to language, virtual, in person, or local, or even free, or at her providers? Even access to lactation consultant, we'll talk about lactation consultants and their role in promoting maternal and infant health. And I did not include it here, but I will definitely be adding this next time. It is very much a basic need, and one that we often forget about is the emotional need. the sense of community, the sense of support. We can be able to provide all of these things, but it does not help if with the population we're serving does have postpartum depression or depression during pregnancy, because we know that depression does not discriminate any community or any stage of our lives. So being aware of these basic needs can also help us, be able to work together as we're here meeting to talk about what are some solutions that we can provide for our community. So some social determinants of health, which are often factors that are non-health related or not non-clinical related, things that affect our health. I'm sure all of you have, and myself have very much been affected by one type of social determinant of health, at least in our lives, right? Either not having insurance or the cost of healthcare, right? We might be insured, but our insurance does not have a full coverage of the services that we need, and having a high copay or having to pay for prescriptions and things like that might be a limiting factor for our overall quality of health. Being unfamiliar with healthcare practices, some generations and some communities might not even know about what are some healthy practices to adopt when pregnant. Sometimes you often hear from moms, well, I'm pregnant. Yes, I have my mom around, but I don't know how, I don't know what I'm supposed to be eating. I don't know what I'm supposed to be doing. And sometimes it's a limiting factor for a lot of moms to be able to reach their full potential and being able to be the healthiest versions of themselves. So that is definitely one other factor, as well as just as we mentioned, the access to food. So it's not even just being able to access food, but the quality of food and the insecurity of it. Um, you know, McDonald's is very affordable for a family that is receiving minimum wage. It is very difficult to say to a mom, hey, you know, you can buy all these fruits and vegetables. You have to make sure you're eating all of this. It's great for you. But unfortunately, if she does not have access to one, the transportation, but the money of it, then she will often opt out to pay for cheaper food. And that might not be because she wants to, but because that's all she is able to do. And also housing insecurity, because of the limiting resources that we do see about housing resources in our community, it does make it difficult for moms to decide, well, am I going to pay for prenatal care or am I going to pay for rent? Right. They're often, and I will tell you, I think 100% of the time, they're going to choose to pay rent first. And that's because, so housing insecurity plays a huge role in the overall status of health. And then again, the quality of healthcare. So quality of healthcare can look like, do they have providers that speak their language, that understand their culture, and are able to even respect, like what are the beliefs and practices that they have, and do the providers provide opportunity to ask questions, or is it that they're in 5 minutes and they're out 5 minutes? A revolving door is what we've heard about this. So the overall quality of healthcare also does play a big role in this population, in every population, but significantly in this one. So now we're going to dive into, we've talked about the terminology, what is affecting maternal health, but now what exactly is prenatal care? What exactly is postpartum care, and why is this so important? So we're going to hear from an OBGYN on her perspective on what is prenatal care and its importance.
The prenatal visits are important for establishing that patient to provider relationship. It enables us to monitor certain pregnancy milestones along the way. It enables us to monitor things like blood pressure, weight, make sure that appropriate tests and imaging studies are getting done along the way. This is the opportunities that patients have for asking all kinds of questions, any kinds of questions about their pregnancy. This is especially important for first-time moms because this is a new experience for them. But it's also vitally important for patients who've had children before. Every pregnancy is different. Every baby is different.
and every delivery is different. And even the moms are different from pregnancy to pregnancy. During each visit, we record weight, blood pressure, and we listen to the fetal heart tones after a certain gestational age. And then we review all of the things that we mentioned earlier, things like what are the expected findings, what are the expected symptoms that patients. Early in pregnancy, the prenatal visits usually occur about every 4 to 6 weeks. As the pregnancy develops further along, the pregnancy visits become a little closer together, then becoming every 2 to 3 weeks. And then at the very end of the pregnancy, the prenatal visits occur on a weekly basis until the time of delivery. Our department is made up of OBGYN physicians, certified nurse midwives, and certified nurse practitioners. This provides the opportunity for the patient to really benefit from the diversity and the breadth and the width of our expertise. They can see just one provider if they prefer, but most of our patients enjoy meeting several of the providers in our practice.
So we kind of heard a little bit, what is prenatal care? I'm sure we all have some type of background knowledge already, if, um, for many different reasons why we would, have a sense of what is prenatal care, what prenatal care does for infants and for moms and for even families, is to answer all those questions that they may have. They're the ones who, the providers working with the families, they're able to give them that sense of like one belonging and community. It takes a village to take care of a child. So definitely, this is where it starts, even before this. So it's really important to know that and promote in ourselves and in our community that prenatal care, if someone is interested in having a baby, or maybe they're not even interested, or whatever the situation might be, it's always good to be prepared. And so sometimes the question is asked, when is the best time to start prenatal care? Best time is going to be before actually trying to get pregnant. So making sure that you're going to your physicals, making sure that you are at a healthy weight, because we know weight is often associated with many health disparities during, our overall life, but especially does allow for many complications to occur during pregnancy, like preterm labor, gestational diabetes, preeclampsia, depression and anxiety, and many other things. So prenatal care is very important, as well as postpartum care. We talked about many of the things that, death that does occur is going to be from that delivery date up until almost a year after having her baby. So postpartum care is truly important and it often occurs 6 weeks after she does deliver. But I often try to, encourage the moms that I work with, if you feel like something is not right, if you truly feel in pain, if you feel something's uncomfortable, or you really have a lot of questions, go to your appointment before the 6 weeks. A good provider will allow you to come beforehand and talk to them. 6 weeks is just a guideline, but many things can happen within those 6 weeks. And postpartum care also does allow is to check a mom's mental health status. So typically, and I say typically because it does vary from experience to experience and from provider to provider. One of the follow-ups is within postpartum care is a mom's mental and emotional health status. So asking, how is she feeling? How has she been bonding with her baby and things like that? And sometimes those conversations are a little bit difficult to have with ourselves, with our family members, with our friends, and even with our clients. So being aware that postpartum care is truly important. As much as we emphasize prenatal care, we really should also put a lot of emphasis and efforts into postpartum care education. Taking a step back, I did want to ask, what are your experiences so far, whether personal experience or something that you've seen if you've worked in the community regarding, what are the questions or what are the issues that you're hearing amongst the community regarding prenatal and postpartum care?
Hi, my name is Allison Jacobson, and I work at Prince George's Child Resource Center with Healthy Families and Family Connects. And access to care is a significant issue for the pregnant caregivers that we work with, especially if they have not received prenatal care. It's almost impossible for them to get postpartum care. And so access for those that are uninsured and just the high volume right now and the staffing shortages and at the clinics and things like that are really impacting people.
Yeah, definitely. Thank you so much for sharing. I don't know if did somebody else want to share?
From in my previous employer, when I worked with pregnant moms, one of the challenges that we faced were women who, after having their baby, said that they felt good and they didn't need to go to their postpartum appointment. So just trying to stress the importance of that appointment, even though you are feeling great, but you still should go. So that was one challenge.
Yes, yes, definitely. I've often heard of that as well. And I know that Karen put in the chat saying that they often miss their postpartum appointments because they feel okay, same thing, right? Or that they couldn't find a babysitter and had a scheduling conflict with medical appointments or forgot to reschedule. So sometimes, I think that naturally, what we see in moms is once the baby is here, all efforts are put into, let me take care of the baby. I have to get their appointments, which is, yes, that is true. But they often, that's where sometimes some of the neglect starts to happen personally for themselves. Sometimes they do rely on, their peers, like, oh, is this normal when I'm experiencing these symptoms? And maybe for that person, they were like, oh yeah, I mean, that sounds normal. Like, I don't think you need to go to a doctor for that. They're just not gonna listen or things like that. So having that unwelcoming start, like especially with a babysitter, like having an environment where it's maybe the provider setting is not as welcoming with babies, or it's a little bit hectic, could be a very big barrier. The access to healthcare resources overall is very much limited, especially with the pandemic. We have unfortunately lost a lot of healthcare professionals who have left the field, due to burnout and many other reasons. And its overall influx in demand has made it very difficult for many people to get prenatal care access, as well as one of the things that I've often heard is, especially I would say with the communities in Prince George's County, has been that because they were 6 months or 7 months pregnant, the providers will not take them due to being so late in their pregnancy, due to the providers being fearful of any complications that may happen from that pregnancy. So unfortunately, we do see a lot of these barriers, and that's why we try to very much just promote this holistic, approach, and just being able to equip them with all the tools that they do need, and emphasizing like, yes, postpartum care is important. Even if you feel fine, it's better to go instead of, when things get rough. So some of the things that we can also do, to promote healthy pregnancy outcomes for ourselves and others is, helping making sure that you do stay up to date with all preventative healthcare appointments, as stated, right? We want to make sure that everybody's healthy even before pregnancy. So that way, if they do become pregnant, they do not have any complications, or at least not as many complications. Also, by staying healthy with our preventative healthcare appointments as people who may not be pregnant, we allow an environment for the mom and the baby to be healthy. So, for example, with vaccinations, we allow for herd immunity to protect the mom and baby. So often, we want to stay away when we are sick, especially with COVID. We saw a lot of that. We don't want to be around our mom and babies when they are, very vulnerable at that stage. They're healing, they're growing, and all of these things. So we want to make sure we're up to date with our vaccinations and our overall health before we do interact with this community. And just being aware that, you can ask for help. There is a lot of great organizations, especially coming out of COVID, that have decided to or have dedicated themselves into this field and this need. So asking for help can look like accessing your Department of Health, nonprofits, peers, or schools. If this is, a lot of schools have started to develop the community school concept, which means that a community school coordinator for the schools that are Title I, which tend to be the communities that have the most needs. Community school coordinators are specialists who know about resources and often work to bring resources into their community. Something I often try to emphasize with the community that I work with and with people in general is that if you have a child at school, go to every health or parent night or whatever events that the school have, because they're often approached by service providers to bring services into a community. So, and those service providers are often the ones providing free to low cost services. So that might be one strategy to bring up to families is just, hey, make sure you're going, it's a great access to getting to know what is out there, as well as just maintaining a healthy diet and exercise. It is difficult to be able to do that, for many reasons. I think that we've all struggled at one point in our lives, with maintaining a healthy routine of healthy diet and exercise. So being able to promote that is definitely needed. There's many great videos online that are for the prenatal population and postpartum population, as well as, taking action where if you have, if you're someone who works with a lot of pregnant moms, then seeing, could you start a, maybe once a week, you all meet up at a park and you walk for 30 minutes or an hour, to be able to, one, get that social engagement, but also that development of an exercise routine for the mom. Again, we said learning about pregnancy and community resources, there's always new ones coming out, and just connecting with others like here today is very important, because then you're able to learn more about the other resources that they provide. Also, just remembering that, it is a village to take care of mom and baby, and partners and support persons can look like anybody. They can be a friend, a family, or a specialist. So identifying those roles and those people in that person's life is crucial to be able to truly support them for the positive changes that we want to see in our overall maternal and infant health population. I did want to mention that there is the safe haven law. So the safe haven law is not many people know about this. Under the safe haven law, a distressed parent who is unable or unwilling to care for their infant can safely give up custody of their baby, no questions asked. Newborns can be left at hospitals or law enforcement stations, some which you can find by connecting with your local Department of Health or calling the number that you see here. So the safe haven law, I definitely do share this information often with families, as much as we want to promote, healthy families and happy families, everybody has a different situation, what they're going through. And we've often heard on the news, right, that babies have been found in dumpsters and schools and all of these unfortunate places. So with the safe haven law, they're able to leave them at these different places, no questions asked, and just like, I relinquish all my rights. This baby is a safe haven baby. So they typically take the baby, and from there, they do take, they process what's going on with that. They'll probably do like a health assessment and make a report and things like that. But the mom does not, or the person who is turning in the baby does not have to be there. So I do encourage you all to share this information with the families and friends in your area, or just having that information for yourself, that, you know, there is no, this is judgment free. And if this is something that you're able to share, please do share that website. I will also be sharing a flyer on this in English and Spanish, because I don't believe that the website has it as accessible in Spanish. So I did translate it so that way we can get that information out there. And I did see in the chat where it says, where Karen shared that there are some states that have safe haven boxes where a baby can be left as well. And so just getting that information of like where are some places will be by calling the Department of Health or calling this number here to know. So originally what I was going to do with accessing healthcare, prenatal care, I was going to dive into the different programs, but because it is very different for each county, I'm going to talk about a little bit the overall accessing of healthcare, and I will be supplementing that information with after this session in an email that has information regarding Baltimore City and Arundel, Montgomery, and Prince George. You know, how can you access healthcare resources in those county for prenatal care? So I often do a session with my moms, especially I work a lot with teenagers, teen moms, for example, and we often hear, well, I'm pregnant. Now what? You know, what are you supposed to do? Sometimes this could be a welcoming thing, or something very shocking, or all of the above, right? For somebody who finds out that they are pregnant. So what are some things that we can promote for them to start to do, or kind of like a guideline, so to say? So first, we would definitely want to just make sure that they're able to kind of have some type of recollection or some type of information when they had their last period. And if they had inconsistent periods, more less to be able to remember when was the last time they had intercourse. So that information is very crucial, right, to be able to find out the status and of the pregnancy, and in order to check, you know, the different milestones that are to be seen in an ultrasound or at a healthcare visit, as well as being able to figure out the due date. So next step really is to also make an appointment with an OBGYN or visit a local pregnancy or women's center to discuss the best next steps for that person. Many pregnancy and women's centers offer low cost and free services for uninsured. There's some pregnancy centers that they will do a pregnancy confirmation test for free, or it will be only $10, or the first ultrasound may be free and it will be facilitated by a nurse. So each pregnancy center has different services. So I do encourage you all to look for those pregnancy and women's center for the services that best fit your needs. Next, it would be just to ensure that you follow up with those appointments that are necessary with the provider, because they would be able to make sure that your overall quality of health is being followed through. And then next is access any additional resources, which are often accessible through those pregnancy and women's centers, Department of Health, and providers. They often have started to share more resources, but all in doubt, please call the 211 number. That is the number for Maryland to be able to access resources depending on your need for wherever you live. So if you are someone who has insurance, one of the things to do to access an OBGYN is to call your insurance. So an insurance is able to come up with a list of different OBGYNs or other specialists that are who accept your insurance. And sometimes you're able to ask, well, will I have a copay? You know, how much is covered with this provider? Are they in network and out of network? So having the out of network tends to be the more expensive route, or is not as covered as often. But with the in network, you're able to make a selection from there. And typically, I believe most insurance companies, when you do see the list online, because you can call and ask for that list to be emailed or text to you, or you can go online on your insurance provider and you can see there what are the OBGYNs that are closest to you that accept your insurance. You can also do this if you work with clients and they are insured. You don't have to be a member of that insurance to be able to see their list of providers who accept that list. So for example, if you have somebody who has a married group, right, you can go to a married group website and look list of providers and select the OBGYN in a certain zip code, and it will come up with a list of providers who accept a married group. If you have no insurance, then again, often the pregnancy center or women's centers might be one of the best places, as well as community clinics to be able to access some form of prenatal care and the resources that go with that. And all in doubt, definitely going to the Department of Health and Social Services would be able to provide you with that information of where to start. There are several community resources that are available to help you access prenatal healthcare and well-being services, and that transforms to the prenatal care setting to even situations where it's just having moms meet online for support groups. The La Leche League is an often group that many moms go for breastfeeding support. It's believe there typically is a couple, I think I want to say one or two in each state. I believe there's one in Montgomery County. It's in West Montgomery County in the Rockville Gaithersburg area. You can look them up on Facebook as a Facebook group, and typically they have a lactation consultant part of that group who do support the moms. It is a nonprofit. So these are some of the flyers that you will be receiving, where it's an I'm pregnant now what that is customized to fit the county that you serve, as well as those steps that we talked about to help moms just kind of have an overall sense of what they can do. Each group actually has been created, each county has created their own version of a Facebook group to allow moms to hop on there if they do have Facebook, and to share, if they have no longer need for maternal service, for maternal clothes or infant clothes or whatever it is, they can go on there and they can just post like, hey, I'm willing to donate this for free to whatever mom needs it. This all came out of the Montgomery County group. I did facilitate and created the ones for Prince George and Baltimore City, just to be able to see if we can get that up and going. So feel free to share that as well. So we will definitely take about 10 minutes just to kind of like refresh and allow you to be able to go to the bathroom, get some snacks, get some water. If you have any questions, please feel free to put them in the chat and we'll return to be able to address some of those questions. So we will return at 7:05. Well, I hope everybody had a lovely break. We'll push through a couple more slides and definitely give the opportunity at the end for anybody who does provide services for the maternal and infant health population to share what they do, what are the services and how to access that information. So, I did see some information started to be shared in the chat, so absolutely great. And if we don't have any questions, we'll go ahead and jump back on. So birth plans are often tools that we'll use with moms. How can we help moms promote the healthiest behavior changes and access like information that they can carry with them for their delivery. So birth plans are a written plan by a pregnant person that is set out in advance her preferences for labor, such as choice of birth settings, method of pain relief, any cultural practices with the delivery, or with the baby being born. So the birth plan can be, it's not a contract that a mom has to stay by. She can fill it out and go completely the opposite way, when it is time to deliver her baby. And also just remembering that, birth and pregnancy does not always go as planned. So, just reminding moms that, this is just more so as a guide to be able to voice her needs and her wants and desires for her birth experience. And so it's, as stated, it is a guideline. Coaching Salud Holística does provide an English and Spanish version for free online. So you can definitely visit us online and go under pregnancy coaching. You will definitely see there a free downloadable copy of the English and Spanish version where moms can print, and you'll definitely see a lot of where it says her information, where is she receiving prenatal services, what are some health conditions that she might have, so that way she can make a copy of all of this information and maybe give one to her OBGYN, maybe at the hospital or wherever she does deliver, and also with her family, so that way if in need of emergency, the family is aware of what her desires are. So as stated, feel free to visit us online to be able to download that. So childbirth education is designed to help women or families access accurate and up-to-date information about their childbirth and make informed decisions about their care. So a lot of moms might, they may say, I don't need more information. This is a traditional, this is a natural thing that happens pregnancy is normal. I don't need to know anything else about it. My family went through it. They'll be able to guide me. Although, while that is true that they'd be able to give some information, we also do want to provide additional information for the things that might not be typical in that family. So, for example, if a family has never had her peers or her community has never experienced a cesarean procedure, then we definitely want to give her that information. What does that look like? What does that entail? What is the recovery process? So with childbirth education, you're equipping families to be able to make informed decisions and ask the appropriate questions, especially with informed consent is very important. And there's many legal rights that a pregnant person and family has that they may not be aware that it might be violated. So Coaching Salud Holística also has provided an English and Spanish version of some of the legal rights for birthing people on our website, which are also, feel free to download. I'll also share that as well. Just by providing information even for moms that, she has the legal right to request this information that's being given to her in a medical setting in her preferred language. So the right to an interpreter is there, and it is a lot, but a lot of families don't know about that. We've heard families that they say, or women, for example, they say that they might be Spanish speaking, and the provider will explain like this procedure to them in English, and unless she had asked about it in Spanish for it to be provided in Spanish, they were then able to go to the back of the closet to get that information where the consent form is even in Spanish, and they were able to get an interpreter. So having that type of skills and just reminders for moms and families could definitely go a long way. So having that quality and improvement of quality of care starts with childbirth education. Some additional benefits to childbirth classes can be, it can help reduce and ease anxiety about unknowns of labor and delivery, can help plan out a pregnancy. Something that I often have a conversation with families is that, okay, let's say that this is your third child. So do you have an emergency plan? Meaning, do you have a bag already created, in case that you do go into labor sooner than expected? Do you have a trusted set of individuals who can take care of your child at a short notice? So having those questions allows moms to start to think about it, have those conversations, try to figure out. So that way at the moment, it's not all panic, right? Because I think that a lot of families, what their perspective on pregnancy and delivery looks like is what we see in Hollywood, which Hollywood does a great job of, the theatrical of it, of dramatic look of it, and sometimes as fear imposing on our families. So we definitely want to take them away from that and just being able to equip them with the knowledge, because we don't also want to scare them like, oh, you have to have all of this plan. No, it's just more so like, hey, like, how can we start to think about these things so that way you have an easier transition from the hospital to home, right? Do you have somebody who's going to be helping with the laundry? Are you going to have somebody who's going to be helping with groceries and things like that? As well as childbirth education classes can help ensure a positive pregnancy and delivery experience. Um, of course, there's always some that are complicated that might not be the best experience, but we do want to strive to do everything that is in our power and their power to have them enjoy, be able to connect with their family and their baby during this time. It can also help connect with mom, stated like her body, baby, and partner, and can help identify ways to improve healthy habits to ensure healthy pregnancy and delivery. Some information about breastfeeding at a glance is definitely that 1 in 4 infants is exclusively breastfed as recommended by the time that they are 6 months. The recommendation is for infants to be breastfed for those 6 months, and low rates of breastfeeding add more than $3 billion of cost a year to the mother and child in the United States. And 60% of all mothers stop breastfeeding sooner than planned. Some benefits for infants regarding breastfeeding is going to include a reduced risk of asthma, obesity, type 1 diabetes, severe lower respiratory disease, many ear infections, sudden infant death syndrome, things like diarrhea, vomiting, and NEC. So there's a lot of great benefits that help the long-term health of an infant. Some things that are very much to be shared. If you are someone who is currently breastfeeding, know someone who's breastfeeding, or know somebody who will be breastfeeding, just kind of letting them know like, hey, you're going to save some money with your child's health, because you're going to be able to reduce the risk, because breastfeeding has so many nutrients and vitamins that can help with their immune system. So along with that, breast milk has many disease-fighting factors. They can help prevent mild to severe infections and hospitalizations, and can help, and babies that are breastfed have been seen to have fewer digestive, lung, and ear infections, which we know that if we have babies who have less of these infections, especially in the communities that have limited access to healthcare resources and affordability to it, then they're not spending as much going to the doctor and getting medicine, or in the transportation and everything that adds up with that. Babies born early, who are often known as premature, are breastfed, are less likely to get a serious infection of the intestines known as NEC. Some additional information about breastfeeding is that compared with formula, the nutrients in breast milk are better absorbed and used by babies. And studies have shown that breastfed babies have found that it's found that they do a better intelligence test later on when they get older, and that their eyes work better, mostly because of certain types of fat that is in breast milk. Don't worry, there's a lot of benefits for mom as well. Just as much as, there's benefits for infants, there's a lot of benefits that have been linked to breastfeeding for mom's health, and that's going to be a reduction of high blood pressure, type 2 diabetes, ovarian cancer, and breast cancer. This is extremely important for the moms who are able to breastfeed, because there are a lot of moms who might not be able to breastfeed due to health conditions, or their child is not able to be breastfed. But for the moms who are able to, and they, let's say, have preeclampsia, of high blood pressure during their pregnancy. They often still have high blood pressure after their pregnancy, and the ones who have gestational diabetes during their pregnancy still are at a high risk for type 2 diabetes up until 10 years after she has her baby. So having breastfed allows moms to lower that risk. Of course, with additional lifestyle changes can further give the results that we do desire. And if that doesn't do it for you, breastfeeding actually does burn up to 500 calories a day, which allows moms to be able to lose weight a little bit more quickly after birth. So I did want to share some information about lactation consultant, right? So we're talking about, breastfeeding is important, it's benefits for moms, and for babies, for the ones who are able to be breastfed and to breastfeed. But what happens when mom is struggling? She really is excited. She wants to learn about this. She wants to be able to do it, but for some reason her baby's not latching on, or her baby is always hungry, or she's in extreme pain. What are the things that we can do? Well, we can definitely refer them to lactation consultants. They are specialists who can teach and help moms regarding breastfeeding. So we're going to hear a little bit about lactation consultants and what they do.
Lactation consultants are great and they're at your disposal if you're having any breastfeeding issues at all. We work on everything from latching on to milk supply problems to weaning your baby, anything and everything that you can imagine related to breastfeeding, we will fix for you. You have to, though, find your own, just like you would with a doctor. You have to have a comfort level and you have to be on the same page as a lactation consultant. What's good for your one friend might not be good for another. There are going to be some who are going to have different views on breastfeeding. And it really depends on your lifestyle and what you expect out of it. What you need most is to be comfortable knowing this is your go-to person. This is the person you're going to call when you have any breastfeeding issues. You shouldn't feel like you have to hesitate, and you shouldn't feel uncomfortable at all asking anything that's on your mind. If you are, then you need to find one that's going to fall into the same groove as you are. Lactation consultants are board certified. There are breastfeeding educators out there. There are lactation educators. But if you need clinical hands-on help, you want to look for someone with the designation IBCLC, which is an international board certified lactation consultant. That is how you will know that that person has been through a proper program and has actually taken a board exam to be called a lactation consultant. If you go to the website ilca.org, you can plug in your zip code and they will find for you a lactation consultant in your area. If you don't want to do it that way and you have a friend who's been using one for ages, then absolutely go with word of mouth because that's the most comfortable route. You would typically use a lactation consultant from anything and everything, from the very beginning, from a prenatal breastfeeding class on through weaning. Many women, the majority, use them in the first couple of months after they've delivered, just to make sure. In a few cases, you might, in many cases, moms feel like they're doing fine with breastfeeding, but they just want a breastfeeding checkup. And so a lactation consultant can come in and just examine everything and see how the baby's doing, how you're doing. Then sometimes we're called in for more aggressive issues. The baby's not latching on, mom has no milk, mom has too much milk. There are many different issues, but you should never, ever hesitate to call, because getting issues fixed early or questions answered early is really the key to the entire experience. You don't want to wait too long.
So that is, some of the work that lactation consultants do, and the resources to accessing a lactation consultant can vary depending on what county and state you live in. So for example, if you are someone who lives in a county that often has like maternal health programs, they will often include a lactation consultant with also does have lactation consultants. So referring moms to WIC can allow them to have that access, as well as, if you do have insurance, again, it's just giving them a call, just seeing or checking your membership benefits to seeing how can you access a lactation consultant, who are the lactation consultants who accept your insurance. Many of them might be freelance, so meaning that they might be out of pocket, but they do reimbursement for insurance. So it very much varies. And also just asking, your child's pediatrician, GYN, and other medical providers can give you that information. Worst comes to worst, right? Not being able to get that information from those places, then you can definitely go to those pregnancy centers, local nonprofits that do dedicate themselves to maternal health, and the women's centers will have that information, Department of Health. Feeding, the breastfeeding support groups like La Leche League as a community of moms who support one another, have a lactation consultant who provides that education and just overall support of, that breastfeeding is hard. It is a job, and it's not something to necessarily always feel like an obligation, but feeling like something that, there's benefits for mom and for the child. So breastfeed, the La Leche League that is very active with their community that they serve. So again, they can be found in different areas. I believe that I know there's one in Virginia, Montgomery County. I would have to double check to see if there's any other counties, but they are responsive. If you're not able to get information, usually if you contact one of the Leche League's websites, they'll be able to connect you to that one that's closest to you. I lastly wanted to definitely share, we all have heard about the 988 number. Well, if you have not, typically when we have an emergency, right, when we have a car accident, or there's all of these different things that might happen in need for an emergency, we call 911. So 988 is a national number that has been provided for 24/7. It's a free service in multiple languages to help provide support for those who are having mental health or emotional health crisis, like suicide, and what they dedicate themselves. They have professionals who answer the phone and are able to talk to you. You can also, there's many suicide hotlines that you can also text. So 988 is a great resource to share with moms, because we know that maternal health plays a huge role regarding mental health. Mental health can play significant impact on mom's ability to bond, to be able to move forward, to access, these services that we want them to seek out, right, and connect with. So sharing this is also great. The 988 number, the website, actually, if you go on the website, there's a ability to print stickers. I recently found out in English and Spanish, and you can print 988 numbers and just share that with moms, like, hey, like, here you go, take this just in case you need it. Also, you can download this information right here on the left with HRSA, providing the National Maternal Mental Health Hotline. So they have support teams that are specialized to work with this population. You can call, text, it's available in English and Spanish. I would have to double check if it's available in other languages, but they do provide additional resources. So for example, if a mom did miscarry, if a mom lost a baby, or just overall mom is struggling emotionally and mentally, then they're able to call there. I also encourage for dads. There is such thing as postpartum depression for dads. Dads are often affected, and partners, and also children are often affected during, the postpartum stage. So they may experience some depression for different reasons. So just being aware that dads also do experience a lot of the health conditions and health complications that moms go through as a result of the pregnancy. It might be due to stress, grief, sadness, or just overall change. As human beings, we do struggle with change. So ability to provide those resources is great. And just being mindful that, if we if we're referring out to somebody this information, the best that we can do is that, because there is the other aspect of them having to, they have the information out, it's them wanting to reach out to that number. Also, it's important to remember self-care, right? If we're people who work in service to our community, we often, want to pour ourselves into our community. We want to give them everything that we know that they deserve. But we cannot do that until we do self-care as well. So, there's also numbers and support groups for a lot of the people who do provide support for others. Definitely this is a community within itself here today. All of those who are interested in maternal health and maybe work within that population. We are a community. We all, I'm sure, face a lot of the same barriers and exhaustion when working with, these communities, and it's not their fault. So definitely wanted to share this with you all. And just knowing that um, healthy families, and especially if mom is healthy, then baby has a higher chance of being healthy. So that's where we tie back into that postpartum and prenatal care is super important, because yes, we want the baby to be healthy, but unless mom is healthy, then baby and the family will not be. There's many things that you can do yourself to encourage and improve maternal health, and that you do not have to be exactly a medical provider to do that. You can encourage a family and friends to seek healthcare services. Share the resources that you always find. Put that out there. Like, if you know someone who's pregnant and you have a relationship with them, you can share that information. Like, hey, I know these places that it's not just for people who are low income or are like this or that. It might be something you might be interested in. Just think about it. Sharing the birth plans, that birth plan that I mentioned that has a lot of the information and questions that moms can start asking, might be something to help promote maternal health and also the legal rights. Helping pregnant family members and friends with chores when visiting them and checking in on them. So one of the things to remember is that um, it will go a lot further helping, let's say if you are visiting a family member or friend, or if you yourself feel like you can advocate, that when visiting in that postpartum, that it is more beneficial that they come and maybe help you with the groceries, or help you do the laundry, help you wash the dishes, rely on other people. And that's where a lot of the postpartum planning in that birth plans can help, kind of figure out like, who can we assign to help our village grow, as well as learning more about maternal and infant health. There's always opportunities to learn about them. There's HRSA provides training sometimes that are free. So signing up for those things and other websites that are maternal health. One of the things I recommend is, if you're truly passionate about this field, is looking up, what are the nonprofits, what are the companies, what are the healthcare services or organizations that provide these service, like work with the maternal health population. Let me subscribe to all their newsletters. So that way you can be up to date about the training opportunities, resources, and events that they do provide, as well as volunteer at pregnancy or women's centers. And seeking birth work as an occupation, there's many opportunities to enter this field. You do not have to be a medical provider. You could be a lactation consultant, childbirth educator, community health worker, a counselor. You can be someone who stands up for reproductive health rights, like a lawyer, if, in case a family member is, their rights have been violated, or just like working with the pediatrics, field. So there's lots of opportunities. That information I actually am happy to share. I will actually reshare my screen so that way you can see what you will be receiving. Once I find it. 1 second. So you will all receive this as well as other resources. Totally lost it. Okay, so hopefully you guys are looking at the same thing I am. It's a Word document that has some information regarding our personal social media handles. We do provide, Coaching Salud Holística does provide a WhatsApp group in Spanish for anybody to join in Maryland. And there we're sometimes often, for these type of sessions that we provide, we'll share it on there and things like that. as well as information about the 211. Oh, yes, I can make this larger. Yes. Some information about the 211, about like how can you call there? What about 211 has some information about pregnancy and those services, as well as some information like where you can go to 211 regarding like baby formula, parent education, and other things. And then some general resources about um, accessing the birth plan that Coaching Salud Holistica provides, the rights of people who give birth, the WIC locations, WIC brochures. There's many services that are nonprofits that support and provide some financial type of assistance or emotional assistance with families that are grieving. Sometimes they're online, in person. I know there's one, don't remember the name right now. It's in Laurel, that they do they do a little bit of like assistance with a lot of things that happen with grief, like regarding emotional support and other things. And then Coaching Salud Holistica has also provided a folder that takes you to a lot of different flyers that WIC has provided, that Maryland Health Connections and other infographics that you can print and share with your families in multiple languages. And then from below here, you'll see that there's a list of resources for each county in Central Maryland, like Montgomery County. Here's a list of different resources that you can access. Prince George, as well as Baltimore City and Anne Arundel. Anne Arundel especially has a program that does, I believe it's like pregnancy kits or like birth kits, that has like some equipment, some goodies in there to give to moms if they live in Anne Arundel. So you will have all that information, and as well as just information about, I will be sharing this. So if you want to post this up, if you have this, if you have an office or a storefront, there's a lot of minorities needed to do birth work. And this because we know that by having more people of color in birth work, we can definitely improve the quality of health in mom and babies, especially in the Black community, the Native American community, and the Latino community, amongst other ones. And then here below, after that, you'll also see, this is just kind of some information, just for your FYI, about the different birth work occupations. Typically, what is the national salary? What do they do? This is only a list, a short list, but there's many more positions and occupations that work with this population. So, there's even prenatal massage therapists, doulas, with doulas, there's prenatal and postpartum doulas that have different roles. And if you are someone who is interested in like doula, then Maryland, for example, you can partner with and accept Medicaid. So different forms of Medicaid and other insurances. So doula, you can do stuff like that. You can also be freelance or work for a company. Lactation consultants, and as well as many other roles that you can play if you are interested in being part of this birth work field in a different capacity. So all that information will be shared with you all, but I did want to open up the floor for anybody who did have, who works with this population, to share a little bit more. To recap, Coaching Salud Holistica, my name is Jocelyn Rodriguez. I am the founder, and what Coaching Salud Holistica does, it is a consulting company for health education services in the state of Maryland. So a lot of what we do, we're often contracted by schools, companies, nonprofits, and other agencies where they contract us to provide health education in English or Spanish, virtual or in person, to their community regarding a wide range of health topics, not just maternal and infant health, but also in diabetes prevention, nutrition, and many other things. But we also do a lot of Latino cultural humility training, as well as one-on-one pregnancy coaching, and community health organizing and event planning. So we do try to support a lot of the nonprofits that are in our area, in catchment area, which is Central Maryland, to just help them reach their goals in a different capacity and do a lot of that capacity building, as well as share information with you all. So if you are someone who, let's say, works for an organization or a company, then one of the things that Coaching Salud Holística has been able to do is provide or organize group WhatsApps with many of you may be already part of, where we share resources and events with other community workers and other professionals, so that way they can disseminate that information into the community. So I will also be providing my information in the chat. So if you do want to connect and pick my brain a little bit more about what we do, I'll also be sharing that. If you go to our website, you'll be able to see our portfolio of the projects that we have done in the past and currently, as well as credentials, as all the other services and free downloads for birth plans, health infographics, the legal rights, and many other things. So I leave it at that. And floor is definitely open to anybody who is interested in sharing the services that they provide within their organization.
I can go. Sorry, my camera's not working. But this is Emily. I'm from the Latin American Youth Center, located in Riverdale, Maryland. We have a ton of services for youth between the ages of 12 up to 24. But the one that specifically would kind of go with this whole training would be our diaper distribution. We typically do it every third Friday of the month. But if that does change, we do relay the information. It's from 10 a.m. to 4 p.m. The bigger sizes typically go within the first hour. And also we do have a specialist who does SNAP enrollment and runs our food bank every Thursday. But the other services that are kind of not related to this is we have a host home program that works with youth who are either who are in the age range of 12 up to 17, who are at risk of homelessness, runaways, or homeless youth. We provide preventative services for them. Preventative service can mean many things depending on the case. And we are also currently recruiting for host parents. That's the second portion of the host home program. But we also do run a workforce program that involves job readiness training, a GED program, building your resume, looking for internships, and those things that relate with finding a job. Let's see, and we do have a free HIV testing at the site. And there's another program that's kind of based out of certain schools that's called the Promotor Pathway. And essentially they are mentors for youth within the PG County schools that we work with in high schools.
Thank you so much. I think that that's absolutely great. I definitely have come across a lot of the work you guys do. And I think it's also important to know that I think you brought up a good point, that it's not just mom and baby. Sometimes there's other children in the family that will benefit from a lot of other services. So thank you so much for sharing that.
Yeah.
Did anybody else want to share if they are a service provider? Go ahead.
I actually accidentally turned on my camera. You're not supposed to see me, but I'm excited to see some very familiar names attending this evening's event, and can just already see the connections we can make. So thank you for the work that you're doing. And I know that what you're doing, like with the WhatsApp groups and things like that, is just going to be perfect for our participants, and I won't have to invent a new wheel here. So I think it's really great that you are doing that. And I would love to talk to you about how we can use, like, we have a private Facebook page for our participants where we like to let people know about the services in the community. And yet it's still a safe space for them. So I'd love to pick your brain on how we can just do some collaborative things there.
Sounds great. Yeah, definitely. I definitely, I did put my information in the chat and you'll all be getting my email anyway. So you can go ahead and reply there. So yeah, thank you so much. Yeah. And if everybody has like flyers, you know, that they want to share, feel free to send them to me and I'd be happy to resend them to the group as well as, I do include all flyers that I do get from service providers on my website. If you go to the resource page and into, depending if it's a all state or by county, I'll include that in there in the drive. Anybody else would like to share what they do?
I'll go ahead and briefly say, so my name is Garrett and I work for the Pregnancy Support Program at Catholic Charities here in the Archdiocese of Washington. I just want to say your resource page is really helpful. I've been picking around at, I think when you first sent it I want to say a few months ago, I looked at it and I thought it was great, but just this class today has been a good prompter to go back and take a look at it, especially the birth planning resources that are there. So thank you for putting this together.
Of course. And, you know, definitely I'll follow up with everybody to share that information and, go ahead. I don't know, Karen, if you had anything else.
No, that was it.
Sounds good. No, thank you so much. And, if, you know, I'll definitely allow if anybody wants to share anything else, but otherwise, you know, I am including a, hopefully it opens, exit survey. So that's just kind of for my knowledge, you know, your overall experience, and that way I can send you your certificates, just for being maternal health advocates. And hopefully, you know, in the near future, this would be able to become a multi-series service that, you know, is provided to the community, not just for professionals, but for the community to learn more about maternal health. But definitely, if you want to share, the floor is yours. And if not, we can definitely finish up early once you finish up that survey for myself. So I'm going to take that as we don't have any more speakers today, but thank you so much again. And I really appreciate all your dedication to this. You will receive a copy of the recording and a YouTube link, as well as additional resources. And so definitely with that information you provide in the exit survey, I'll be able to develop this training in a hopefully better version in the future. And looking forward to it. But otherwise, I hope everybody has a good night and thank you so much again.